also factors that you cannot change. Increasing age leads to a higher incidence of heart disease, especially for women. Upon reaching menopause, that is where the heart risk increases, as well as family history. If you have a family member suffering from early heart attacks or heart diseases, you are at risk. So having coronary heart disease can lead to a heart attack. It can also lead to overworked heart muscles, leading to weakening and heart failure. And because this is an entire vessel problem, there's an increased risk of getting a stroke. And also if the heart fails, it will also affect all your other vital organs. So what are the various treatment options for this condition called coronary heart disease? First and foremost, very important are medications such as blood thinners called antiplatelets, statin medication, and also other medications that are good for the heart. Secondly, you have angioplasty, which is called balloon and stent. A stent is sometimes called a ring. This is inserting a small balloon into the heart artery to open it up, and then implanting the stent or the ring, which opens up the vessel. In severe cases, the patient may need to go for open heart surgery, where they graft new vessels to the heart. So let me give you an example. This is a famous road in Singapore. It is called Scott's Road. It is famous because it leads to Orchard Road. And over here, you can see something has happened. There is a blockage. So this is like the heart artery, and there is a severe block that's happening, which is limiting traffic and limiting blood flow. So how do we solve the problem? The first way is to go from the inside to open up the blockage, and this is called angioplasty. You do ballooning, you clear the blockage, and you reconstruct a new wall called a stent. So this opens up the road or the artery from the inside. The other solution is to leave the blockage and the blocked road as it is, and you build a new bypass flyover. You build a highway over it so that traffic or blood may flow through this new road. This is called bypass surgery, and it is an open heart surgery. There are also other treatments, especially in cases where the arteries are really rock hard and they are blocked by hard calcium blockage. In the past, this can only be treated by bypass surgery, but now we have advanced options, we have advanced techniques. On the left, this is a rotational atherectomy. We have a drill to drill through all the hard calcium blockage to open up a channel. You can see that the vessel is open up, and this allows stenting to take place. And on the right, we have an even newer technology called shockwave lithotripsy. This involves using a special balloon that you can see on the right. You press a button, and what goes through are special electrical signals, creating sonic waves that blast the calcium. So this converts the hard calcium and creates cracks within the calcium through the energy from the sonic waves. And this actually softens the calcium, allows the vessel to expand, opens up the blockage, and allows the stent to be deployed. You can see how the sonic waves work in blasting away the calcium. This is a very new treatment that is available in Singapore. and has helped many patients. And after the job is done, you take away the balloon and you implant the stents. There are other approaches as well to open up the blocked arteries. What you see here is robotic PCI. So what happens is that we use a robot arm to control our operations. And we control the robot using this console. So this allows procedural control using a robot. We have very precise measurements and movements because we can control the robot arm very well. And this also lowers the risk of radiation, both to the patient and to the doctor. And this is something that I do. These are pictures of a robotic angioplasty. You can see this is the robot arm where we are preparing. And I sit at a console, moving the robot arm to deliver the balloon and the stent.
Terima kasih telah menyaksikan video ini. Dan jangan lewatkan video menarik lainnya dari channel Tekon TV. Sampai jumpa di video selanjutnya. Stay healthy with Tekon TV.